Welcome back. Prostate cancer is the most common non skin cancer for men, and in the US, 1 in 8 men will be diagnosed with prostate cancer in his lifetime. Addressing the issue, Essen Health Care is encouraging men in the Bronx to test for prostate cancer with a free screening. Joining me now to discuss their free screening event is Dr. Sahgal, Chief Medical Officer at Essen Health Care. Doctor, thank you so much for joining me.
Good morning, Kibin. Thank you for inviting me over to your show.
Now, let's jump right into it. Can you first explain how prostate cancer affects men?
But prostate cancer is a cancer, like you said, which is the second most common cancer after skin cancer, but is the second most common cause why men die from cancer after lung cancer. It's a gland in the body, and as with age, as you get older, the risk of cancer increases. And that's what has happened to the men, as they get older. 6 out of 10 men over 65 will be diagnosed with prostate cancer, and 2 or 3 of them may die from prostate cancer.
Now, can you let us know where is the prostate and how do you test or screen for this type of cancer?
A prostate is a very important reproductive gland for men. It is located right at the tip of the bladder, where just behind around the tube called urethra, which empties the bladder, and right in front of the rectum. It's an important gland because it helps to bring the fluids, the sperms from the testicle, adds fluids to it, and creates the semen, which is injected through the penis at the appropriate time for reproduction.
And how do you test for prostate cancer or screen for this?
You know, it's the prostate cancer is tested by blood test. In old times or long time ago, we used to do digital rectal exam, but now there's an enzyme, a substance made in prostate called PSA, prostate specific antigen. And there's a normal level of prostate specific antigen in the body. And when there is more of it in the prostate secreted into the body, that's an indication there's something going on in the prostate. It doesn't mean if your PSA is high that you have cancer, but there's a chance of you may have cancer. So we would need to do more tests for that, and that is where after the screening, we actually may recommend further testing for prostate cancer screening. But the screening test is prostate specific antigen.
Now, I understand that Black and African American men are uniquely affected by this. Can you explain how this cancer is affecting that community?
You are absolutely right. African American men are not only more likely to get cancer, but also may get cancer at an earlier stage, can get cancer at a diagnosed in a more advanced stage, and if not treated, can have a worse outcome than other men. So it's very important for African American men and some other men who have genetic predisposition to get screened for prostate cancer.
Now, I wanted to know, you kind of hint at it a little bit, but I wanted to know, are there any pre-existing conditions that can affect this? Because we often see this a lot within Black communities. This community tends to be a little bit more vulnerable when it comes to maybe cancers or other health conditions.
Um, you know, it's an excellent question. Uh, there is some evidence in science that higher level of fat in diet can cause a little more risk in prostate cancer. So red meat and other sources of animal food cooked at high temperature, high heat can. So that's why we find that people from vegetarian background tend to have less than people with a high meat intake. Uh, but there are certain diseases that are not specifically related to prostate cancer. It is mostly with age, It is not related to prostate enlargement that comes with age. And, it's just like anything else with age, it needs to be screened appropriately.
Now, aside from your race, how can your family health history affect your chances of being diagnosed?
It's a, there is some genetic predisposition to prostate cancer. So if somebody has a family history of prostate cancer or any other cancer in the family, I highly encourage them to be, tested for prostate cancer.
So, what are some of the symptoms associated with prostate cancer?
Prostate cancer can come in a very subtle way. You can have problems with urination. You can have problems with a little bleeding. You can also have problem with erectile dysfunction. And frankly, you may have prostate cancer and you may not have any symptoms. So it's very important that we do an age appropriate testing, even if you don't have symptoms. On the other flip side, if people have prostate cancer and it gets advanced, they can get pain in the lower back, weight loss, fatigue, and that should prompt them to go and get their prostate checked.
Now, can you tell us more about the Essen Health Care free screening event that's going to help a lot more Bronx men, take charge of their health and learn more about prostate cancer?
Thank you so much. Essen Health Care is a multi-specialty group practice in the Bronx, and we take great pride in taking care of the community. We are holding a prostate cancer screening program on July 30th at 899 Elton Avenue from 10 a.m. to 2 p.m. And we recommend all men over 40 years of age, 40 years African American and 45 from other races, to come and do the cancer screening. Cancer screening for prostate is best done from 40 years to 70 years of age, although we screen for older patients also, but especially during this age group between 40 and 70, it is very important to get screened. It's done with a blood test, and if the blood test has indication an elevated PSA, then we would refer them to the appropriate specialist for further testing.
So, I understand that this is by appointment. How can people actually sign up and make an appointment?
People can call up today and register and add a phone number and register. The phone number is 646-921-3007. They can also go to Essen Healthcare website and register for the event. It's snhealthcare.com.
Now, my last question is, what are some other ways people can screen or test for prostate cancer if they can't make it to this event?
Well, they can go to their primary care doctor, and then they can get tested for prostate cancer, again with a blood test. And that's the most routine test for prostate cancer. Primary care is very important for cancer screening, and I highly encourage them to go there.
So, can you just let everybody know how they can stay up to date with your organization?
You know, we are all over the Bronx, and we love taking care of the community. Our all community can follow us at LinkedIn, in Facebook, Twitter at snhealthcare.com, and that's the same as a website.
All right, doctor, thank you so much for joining me.
I appreciate. Thank you so much for having me.
That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.